Okay, I think, are we recording? Is it showing up?
Uh, it says I'm sharing my screen.
Oh, it says I must be. So, all
Okay.
right. Well, hi everyone. This is Sarah Clute-Bain. I am the Boone County Hospital Foundation Director, and we have been trying to have a monthly Educating Empowering You program continued into the pandemic and pandemic part two. Um, and we'll continue to do this as long as we need to. And actually, I think this works out really well because we are able to be in the comfort of our own homes. We're able to record it and send this out. And yeah, so one of the few things that we've been able to benefit from the pandemic. So I am going to just start off by saying thank you to Shiloh Burke for being here today. She's going to share a little bit with us about Medicare plans, Medicare Plan B, right? Is that what it's called technically?
Just Medicare options.
Yeah.
Yeah.
Okay, so you'll get into more of the details for us.
I
So
Yes.
yes, so I've known Shiloh for many years. I know that many of you probably listening may know Shiloh as well. I'm just going to turn it over to her to go ahead and get started. I will say really quickly too, as we're getting started here today as well, my program from October had to be postponed to December. So I'm working on getting our female family practice physicians together to do a women's health program. So that will be coming out in December. So just everybody listening, make sure you check that out when we get that advertisement out, and love to have everybody on board for that. So without further ado, I will turn it over to you, Shiloh, to get started with your program.
All right. Well, thank you for having me today. Um, I'm excited to be here with you. We're all getting used to, well, I am still doing online everything. So this is my first time presenting. I've sat in a lot of webinars, but I don't get the chance to present real often. So you'll have to bear with me. I'll do my best. Today we're going to go over some Medicare options made clear and how it all works. So yeah. So a little bit about me. I live here in town. I'm from Boone. My husband and I have two daughters. They both go to Iowa State. Integrated Insurance is a family business. We have an office here in Boone where you'll find me, and then we also have an office in Polk City where you'll find my husband's cousin and uncle there. Um, yeah, I'm very active in the community. I always have been. You may have seen me around town. I've sat on the school board. I've taught Sunday school in Boone, lots of different volunteer work, Girl Scout leader, all that fun stuff. Uh, so, Sorry, you'll have to again bear with me as I have my little note cards here. What we will be going over today, let me pull up my slides, maybe here. Uh,
I can see your slide just fine.
Okay, you can? Okay. Oh, here we go. Okay. Let me make sure I get all of them here. Whoops, there we go. Okay. So here we have the two locations that we talked about. Um, 915 8th Street. It's a big brick building on 8th Street down the street from Hy-Vee, and then 1010 South 3rd in Polk City. We're there by appointment, so definitely give me a call. I'm happy to meet anytime. I'm having trouble getting to my different screens here, but we'll get there. What we will be going over today, Medicare basics, Medicare options. So when you start with Medicare, you're going to start with Medicare Parts A and B. So Part A, usually you don't pay for a premium. That is after you've worked, you retire, turn 65, most people automatically get enrolled in Part A. Part B, most people have a premium for. Part A helps pay for hospital stays and inpatient care, where Part B helps pay for doctor's visits and outpatient care. So think of those as the base to your building blocks. To move forward with either a supplement or an advantage plan, which we're going to be going over those two options today, you have to start with Medicare Parts A and B. So that is going to be the base. To do anything else, we have to have Parts A and B. So from there, we will go. Does anybody have any questions about Medicare Parts A and B? Usually people have Medicare Part B taken out of their Social Security, so you don't have to worry about paying that payment. And I believe, what was the premium? I have 148.50 is what it was for 2021, and that's the premium for most people.
And that's for Part B,
Part
148.
B, yep. Most people don't pay anything for Part A. And then Part B is in 2021, it was 148.50. And that, to move forward, you have to have Part A and B. You can't get a supplement or an advantage plan without both of those.
Okay.
So
Is
you're off.
148, I'm sorry, is the
No,
148.50 per month or is that per
yes,
year?
that's your monthly premium for Part B. And most people have that automatically taken out of their Social Security check.
Okay, got it. Okay, thanks.
Yeah. So there is your start to Medicare. And from there, you have two different options. You could go with the Medicare supplement plans, and that you would have your Part D plan, and that helps pay for your prescription drugs. And that's a pretty specific plan. We would definitely want to make sure we input all your prescriptions. There's lots of different options out there. I'm an independent agent, so I work with all the major carriers, but that's important that you're on the right prescription drug plan. You would also want to add a supplement insurance, Medigap, and that helps pay some of the out-of-pockets that come with original Medicare. So Part A and B don't pay for everything. And that's kind of a misconception. A lot of people think, oh, well, I have Medicare, I don't need anything else. If you think of Medicare as a road, you can think of Part A and B leaving some potholes in that road for your drug plan, for what A and B doesn't cover. And so you want to make sure you fill those potholes so you have the perfect road or the best road for you. And so that's where your supplements come in. So supplement, it just depends on your age, different demographics, whether you're a tobacco user or not a tobacco user, as to what your premium would be for your, we'll say Part F, Part G, something like that. So that depends on a lot of different things. And like I said, I work for all the major carriers. So we really look at that and see what's the best plan for you. When shopping for a Medicare supplement insurance plan, it's important to look at their ratings as well. And so I always do that. I only work with companies that have good ratings. So that's something that you'd want to consider when shopping for a Medicare supplement plan. The pro to a Medicare supplement plan is when you pay your premium, then you really don't have to worry about much else. There's usually a Part B deductible that you'd have to pay for on most plans. But for the most part, most of your medical is going to be paid for by your Medicare supplement. And then your prescription drug plan, depending on what drugs you're on, helps pay for those. So that's the nice thing about the Medicare supplement is you know what you're going to be paying then. But you're paying whether or not you use it. So that's both a pro and a con, depending on how you look at it. Option 2, we'll move forward then, is your Medicare Advantage plan. Okay. So your Medicare Advantage plan, it's also referred to as Part C. And they're approaching their 25th birthday of being around here. So Medicare Advantage plans combines original Medicare Part A and B coverage in one plan. Usually includes a prescription drug coverage and may offer additional benefits like vision, hearing, and dental coverage. Those benefits are nice because those you're not going to find that usually on your supplement plans. And it's a huge benefit to get that vision, hearing, and dental coverage. So a lot of people really like Medicare Advantage plans. They're usually $0 premiums, so you don't have to worry about paying that monthly premium, but you are going to have copays and deductibles. So instead of paying that one premium and really not having to worry about so much else, you're not going to pay a premium, but pay as you go more. Oftentimes there isn't copays for regular doctor's visits. And that's why it's important to sit down with a local trusted agent so that you can really look at what option's best for you. Because what's best for your neighbor probably isn't going to be the best plan that's best for you. And so we really want to look and customize the plan to see what the best option is going to be for you. Like I said, there's no one size fits all. Some people prefer the supplement, pay one bill a month and not have to worry about anything else, where some people think, well, if I could save quite a bit of money, I'd rather go that plan and have the vision, hearing, and dental. But Medicare Advantage plans aren't free, and that's often a misconception. I really want people to know that you do have the copays, sometimes deductibles, stuff like that. So again, when people meet with me, I really try to go through everything so that there's no surprises, so that you know all the benefits and everything, so that you would know. One thing that's nice about the Medicare Advantage plan, sometimes people are a little nervous to try anything new, and I understand that. I'm not huge with change. So the nice thing about a Medicare Advantage plan is you do get a 1-year trial right. So if you decided, I've heard a lot about these Medicare Advantage plans, a lot of people love them, maybe I want to try it, but will I be able to go back on the supplement that I had before? Yes. So you get a one-time trial right, and within that year, if you decide it's not for you, you can go back to the plan you had before without going through underwriting. After that year, you would have to go through underwriting to get back on your supplement, like a Plan G or something like that, Plan F, any of those. So that's something to consider, but it's nice to have that option where you could try it a year and see, is this beneficial for me? How do I like this? Do I mind paying the copays? How much money is this saving me? All of that. So that's a great option for people. So you don't feel like you are stuck. There's that option. Like I said, Medicare Advantage is approaching their 25th birthday and have been growing in popularity. It's a great option. I have many clients that love the Medicare Advantage plans, but they're not for everyone. And that's why I really like to go through all the options at appointments. There's no one size fits all when it comes to the options for you. That's why it's important. Again, this is so important to meet with a local agent that can walk you through all your options to find the best fit. And I'm also available year round to help answer any questions. I just had a client of mine call me this morning and tell me that she had a phone call today and it was from some agent from a call center. She didn't know who they were, where they were from, and they kept wanting her Medicare number. You know, it's nice to have someone local. You can if you have a question, you know where they are, you know where to find them. They're embedded in your community. They care about you. We really want what's best for you. So that's why I tell people, my biggest advice, if you take nothing else from this, go with a local agent, even if it's not me, which I'd love to have for me to be your local agent, but it's just so important to go with a local agent and not those call centers, in my opinion. Because what do you do if you have a question? It's just so much easier to go with a local agent that that cares about you. Does anybody have any questions about anything? No? Again, we talked about this a little bit, but I think this is important to touch back on what happens if I try an Advantage plan and change my mind. Essentially a 12-month period to try out a Medicare Advantage plan. So, I really don't see a downside to most people trying an Advantage plan as long as we find the best one that's a fit for you. But that's not to say Medicare supplements aren't a great option as well. I do it all, supplements, Advantage plans. When I meet with you, I certainly would not want anyone to feel pushed in any certain direction. I really try to go through the pros and cons of all so that we can find the best fit for you. But I love that Medicare Advantage plans have this trial right year. I think that's fabulous. What happens during a complimentary consultation with me? Well, we usually meet up at my office. We would go over your Medicare needs, really find out what you like about the plan you're on. If you're currently on Medicare, what you dislike about the plan you're on, all that stuff. Go over your Medicare needs, go over your prescription drug list to find the best plan for you, whether that's a Medicare Advantage plan or a Medicare supplement plan, Part D. We would also price out various supplements and compare them to Advantage plans if that's a route you were thinking you might want more information in. And these are all complimentary. You don't need to be my client to come in for a consultation. I'm not a high pressure person at all. I just want to make sure that people have the best option for them, because there are a lot of options out there, and I just want to make sure you're taken care of. So yeah, I would love to meet with anyone that has questions about Medicare. If you're currently on Medicare and have questions, if you're going to be going on Medicare and have questions, there's no harm in meeting with me. Like I said, I'm not going to be hounding you. I'm not going to be calling you constantly. I just want to make sure that you're taken care of and have the best options for you, and that you're able to look at all the options. I'm here year round. We're a family business with decades of experience between all of us. We have 2 locations, and I'm always just a phone call away. I also like to meet yearly and discuss how your plan is working for you. So one thing that I do for my clients is I do call or email, whatever you prefer, at some point through the year, just to see how your plan's working, if you have questions about it. And I want to make sure that you're getting all the benefits. A lot of the Medicare Advantage plans have over-the-counter cards that you can use to get free products through the year. Some offer Fitbits. Some have dental, vision, and hearing. So I want to make sure that you know how to use all of the added benefits to those plans if you are on an Advantage plan. For a supplement, I still like to check in and just see how everything's going. Make sure that everything's okay. Like I said, I'm always here to answer questions any time of the year. Yeah. So I don't know if anyone has any other questions for me.
I have some questions, and then we do have some people here if you want to raise your hand or unmute as well, if you'd like to. But just a couple of things for me. Like, obviously, I'm a little ways away from this type of thing, so just to help me understand a little bit better, so that I can speak intelligently about it too. So, when somebody retires,
Yes.
they're automatically enrolled in Medicare A.
And when you turn 65, most are automatically enrolled in Part A.
Okay.
And
So
then
then,
Part B is
oh,
optional. And most people wait till they retire to sign up for Part B, since there is a premium.
okay, got it. So, and then I assume you have software that you can run all this detail through, because it's obviously really hard for you to give a lot of detail because everybody's going to be different. So
100%. Yes. Yep. I use different programs, and what I will do is I'll punch in all your demographics. It'll spit me out all the different options in the area. From there, I'll look at what companies have the best ratings, all that. So yeah, yep. I do all that for you. So I try to make it as easy as I can, because I know Medicare is confusing. I remember when several years ago, when I started moving towards specializing towards Medicare. And I just remember thinking, oh my gosh, this is so much information. I felt like I was learning a foreign language. So my
mm,
whole goal in helping people with Medicare, and one of the main reasons why I wanted to specialize in Medicare, is because it's so overwhelming. And I really want to make this process as painless as I can. And sorry, I have a puppy. So
I can come visit.
yeah.
I can't hear him or
Yeah.
see him, so it's all good.
He
But
knocked over a little thing. It's no big deal. But anyways, yes. Hi, Archie. So yeah, I really do try to make the process as smooth as I can. and make it as easily understood as I can, because I know it's a lot to process. I do have fabulous brochures that I love that really break everything down and give different scenarios. And I give those to everyone that comes and visits me. I always have those available. It's just a booklet, and it talks about the whole process, what Part A covers, what Part B covers, your different options, whether it's a Part C Medicare Advantage plan, or if you decide to go the supplement route. Also in that book, it has scenarios. If so and so went to the doctor and he had this plan, what would this cover? How would this work? So I know it's a lot of reading, but I kind of go through that at the meetings too, so you know what the biggest points are in that book.
Sure. Shiloh, would you want to put your phone number page back up so that people have that in front of them?
Absolutely.
There you go. That would be
There
good.
you go.
And then
Yeah.
you said that you take appointments pretty much, I mean, obviously
Yeah.
within reason, anytime. So people just
Yeah.
call you at that number listed below, the 515-230-2042, and
Yes.
they would set an appointment with you. And let's say they go through everything with you, but then they find out that their brother-in-law is doing the same thing, and they're going to go with somebody else. But how does any of that work? Or I mean, just
Sure.
logistically meeting with you, and then from that point forward, how would that go?
Yeah, absolutely. So usually at our meetings, like I said, there is no obligation. We would just meet, go through options that I offer. Yeah, and if you found out your brother-in-law also sold Medicare supplement plans or anything like that, then that's okay. Uh, we could still, I'm still happy to meet with people. I offer a lot. Obviously, if I'm competing with family, you're going to go with your family as your agent. But
Yeah.
I have a lot of happy clients out there. I really take pride in what I do and taking good care of my clients. I always tell people I would never put a client on a plan that I would not put a family member on. So,
Right.
I think that my clients would definitely attest to that I do take good care of them and they feel comfortable with me as their agent. So,
Yeah.
yeah.
And I mean, sorry, muting somebody here. And my thought process behind that was just people's level of commitment, like if they felt any obligation, but also, you talked about having someone local. And I think that that's another point to emphasize too, is that having somebody local and not somebody calling you from a call center, like that client experience, I mean, that just, it's a little
Yes.
unsettling because we do become so nervous anymore with
Yes.
all the things and all the different scams that could potentially be out there, and somebody trying to get, personal
Absolutely.
information from you that they should not have, and all that. So,
Yes.
yeah.
Yeah. I always recommend do not give your Medicare number out over the phone. There's just no reason to do that. You can meet with me or any other local agent. Also, I'm an independent agent, so I'm not just working with one specific company. I'm really going to lay it all out there and look at all the different companies, all the different major carriers, and we can really find the best fit for you too. So I'm not swayed in one direction or the other. I really try to find the best option for you.
Okay. That sounds great. We have some participants on? Does anybody have a question? You just will have to unmute yourself if you do, or I think there might even be the option to maybe raise your hand. I can't see where that is, but anyway. I don't know. I feel like it's one of those things that it's really a good reminder. Oh, and we didn't talk about the date. So what's the due date?
Gosh, yes. I'm so glad you brought that up. October 15th through December 7th are the
Okay.
dates that you can sign up for if you're on a supplement and you want to switch to a different supplement. Actually, if it has to go through underwriting, which would be like your Part G or F or any of those, that if you have to go through underwriting, that's something that can be done any time of the year. Part D supplements can only be done October 15th through December 7th, unless you're new to Medicare, have a life change, something like that. And then the Part C Medicare Advantage plans, if you're moving from a supplement to an Advantage plan, we would need to do that now. If you're on one Advantage plan to another, we could do that at the beginning of the year as well. So like I said, it's all very confusing.
It
But
is a
yeah,
little confusing, but Part D is the
yes.
most important thing right now to explore because that has a deadline of December 7th.
Yep. And the same if you're thinking at all of switching from a supplement to an Advantage plan, that would be a deadline of December 7th as well, I believe. So yeah.
Okay.
Yeah. Yep, and I'm available. I work crazy hours this time of year because I know we're in a crunch and I'm happy to meet anytime. I really try to be as flexible as open as I can. So yeah. Yeah.
Excellent. Well, I certainly appreciate the information and just knowing,
Yeah.
I mean, you laid it out very well in terms of helping
Thank
me.
you.
I've heard this several times before, but every time it's like, oh yeah, okay. Like I learned something new or take away a little different
Exactly.
piece. Like what you said, it just can get really overwhelming, and it's good to have
Yeah.
people who know and understand this to be able to walk us through. So I'm going to give one more chance if there's anybody that has any questions to jump in and ask Shiloh before we sign off today. We knew that it was going to be about a half hour. You did well. So
I tried. I tried.
a lot of information in a
Yeah.
small amount of time. So
And if anyone has any questions, feel free to contact me anytime. I'm only a phone call away. And I am happy to answer any questions, whether you're a client or not. I'm still happy to answer Medicare questions if I can. So
okay, great. Well, I don't see anybody unmuting, so I think we've given them enough
all
time
right.
to do that. I appreciate your time today,
Yes.
Shiloh. Thank you so much for
Yes.
walking us through that. And again, if anybody would like to reach out to Shiloh directly, that's her number there on the screen. Or for some reason you're only listening and not watching, I'm going to say it out loud. It's 515-230-2042. So thanks,
Yes.
Shiloh. Take
Yes.
care.
Thank you. Thank you for having me.
You're so welcome.
Bye-bye.
Bye.
Thanks. Bye.